Pleasure to welcome to the show from Sandhills Oral Surgery, Dr. Gary Jones. Good morning to you. Good to see you.
Good to see you too. Thanks, Goldie.
And I just got to tell a funny story. You know, we're talking to Megan Maxwell about 10, 15 minutes ago from the Museum of the Cape Fear. Dr. Jones is sitting out in the lobby. Jim comes in and goes, "Is that Dr. Jones?" I said, "Yeah." "Oh, you did my implants." And then Megan turns around and goes, "Oh, is that Dr. Jones? I have a noon appointment with him." "Well, you should just move your office right here to the Cumulus Broadcast Center."
Considering it, I agree.
How long have you been doing this? What got you into dentistry? You look like a kid,
Thanks,
for God's sakes.
I appreciate that.
I'm sure you hear that all the time.
24 years, actually. Originally from Pittsburgh. I had trauma when I was a kid and lost some teeth and spent a lot of time in the dental office and with my orthodontist as well.
Right.
Trained at Pittsburgh and then went to Medical College of Virginia. Owed Uncle Sam a couple years, so I was a staff surgeon at Womack. That's how I ended up in Fayetteville.
Good for you.
Yeah, it was great. So, but love it.
How do you make the decision to go from general dentistry to become a specialist in dental implants?
That's a good question. I think, and most patients don't understand the difference between a general dentist and a specialist. A specialist will go on after school to do specialized training. For us, it's 4 years minimum in a hospital to do surgery.
People talk about dental implants all the time now. You didn't hear anything about dental implants a few years ago because people were still getting bridges and partials and dentures, and you'd walk into your grandma's bedroom and her teeth would be in the glass. It's only really in the last few years that dental implants have really become very popular.
Yeah, definitely more mainstay. But implants have been around for 40 years, literally developed in Europe.
They started as wood.
Yeah. But it's a different scenario now. We know that dentures and partials and bridges do damage to natural teeth, where implants don't cause damage. So they are the preferred method for replacing teeth compared to those other options.
What are they made of?
Made of titanium, the same thing that hip and knee replacements are made out of.
Really? Because I know, Jim, you've had the dental implant?
No, he did surgery for me. I haven't had the implants, but I was preparing to get implants.
Correct.
So when you get the implant, does it last for the rest of your life?
The potential is it can last the rest of your life compared to a partial or a bridge, which has a lifespan to it.
Do people still get bridges and still get dentures?
Absolutely. I think a lot of patients, take a look at all their options and make a decision based on their needs, what they'd like to do. But we always go through those options and let them know dental implants are the preferred method, but they can choose whatever option they like.
So if you're missing a tooth and you've got that gap between two other teeth,
yes.
Explain what a bridge, because I don't have a bridge, I don't have an implant, but explain what a bridge is.
Right. A bridge is when they would have to grind down the teeth on either side of that space to put a cap on those teeth or a crown. And then there's a fake tooth fused to those two teeth. It's a bridge. The downside is they have to damage your natural teeth in order to put that bridge in.
Gotcha. So the grinding is not a good thing.
Correct. And the lifespan of a good bridge is 11 to 14 years, and then you may lose another tooth because of it.
Interesting.
And that's exactly what happened with me.
Really? Is that still the most popular choice, though? Because I know that implants can be a little pricey, so...
They are. I think they're the most popular choice because more dentists do bridges than they do implants with a treatment plan. And patients are used to hearing that term, a bridge. And they feel that their dental insurance may pay more towards that bridge than it might an implant, which is
that true?
Changing. No, it's changing. Most dental insurance companies now offer the benefit of dental implants.
Can people of any age get a dental implant? I mean, you mentioned you were a kid when you lost some teeth. Can a kid get an implant?
A kid cannot. I mean, the reason for that is implants will not grow as the jaws grow. So for women by the age of 18, for men by the time they're 21, the jaw's done growing, they're candidates for implants. And then as far as how old you are, my oldest implant patient's 91. I saw her yesterday. She's now 96.
Talking with Dr. Gary Jones from Sandhills Oral Surgery about the newest, can you call it a fad in dentistry?
No fads. I mean, it's scientifically based.
Didn't mean to imply that it wasn't. When I think of dental implants, I kind of think of LASIK surgery. Both recent developments,
Absolutely.
One for the eye, one for the mouth. Is there a lot of pain in the procedure? Because as I told you before we went on, my mother-in-law has had multiple dental implants, and she never really talked about the pain, but I know that it was kind of a lengthy process for her a few years ago.
Right, Jim, I can tell you that I've never had any discomfort with any of the surgeries. Well, my patients, they complain. Jim, do you like that one, buddy? It's really not that uncomfortable. I tell patients it's more uncomfortable to have their tooth removed than have an implant placed. It just sounds bad when patients hear they're going to have an implant placed in their jaw, right? But yeah, most patients, and even those patients where we take their teeth out, put implants in, and put teeth on the same day, it's a 2-day recovery and they're back doing their normal activities.
Now, you have a great story about when Dr. Jones showed you the implant he was putting in.
Yeah, well, first of all, let me just say that my actual dentist, Dr. Wilson, has
Brian,
mentioned that that Brian has mentioned that you need to be on decaf. So we're trying to get him to switch to decaf. Well, at any rate, I'm sitting in the chair. I just had I guess I came back for my follow-up because I don't think you put that stuff in when I had my surgery done. But you're going to have a cadaver bone put in.
Correct.
Okay,
right.
which is going to anchor eventually your implant. And he took the little bottle out and says, "You want to see what it looks like?" And I said, "Sure." It looks like powders. And I'm looking at it, and he goes, picks up the container, he looks at it, he goes, "And this is from, Bob in New Jersey."
That's pretty funny.
We like to put a little humor in our treatment there, Jim. Yeah.
So does the entire process still take as long as what my mother-in-law told me?
Usually not. I mean, with advanced technology, with the surfaces of dental implants, we can take teeth out, put implants in the same day, and even put teeth on the same day. Yeah, not everyone is a candidate for that. It sounds great when you hear it, but each patient has to be worked up and treatment planned based on their specific requirements.
How do you know if you're a candidate for dental implants?
Good point. Well, we look at their health history, make sure medically they're capable of having the procedure done. And then 2, we radiographically work up the patient and clinically work up with photos, models. We take casts of their teeth. People know those as impressions. And then we'll do virtual surgery now on the computer. We'll take a 3D model of their jaw, place an implant in on the computer to make sure we have adequate bone.
Wow.
It's going to be positioned correctly. So it's the last 10 years in implant dentistry has been pretty fascinating.
What is the rise in the number of implants that are being done from, let's go back 10 years. I mean, do you see a rise every single year? Do the numbers go up for you?
Absolutely. I think you probably reach a critical mass at some point where you'll peak, depending on what geographic region you're in. But implant companies show a dramatic increase. Now, there was a drop-off during the recession, right, in 2008 through 2012. But then that's picked back up again, and those numbers, just like the stock market, are up, compared to where it was before.
And I'm sure it's got a lot to do with awareness. Again, like LASIK surgery,
Absolutely.
So many people are uninformed about the newest technologies that it takes a while sometimes for people to find out about what's available out there for them.
You're absolutely right.
How do you care for dental implants? Is there any special care that you take with these?
We see all of our implant patients once a year as a combined effort with their general dentist to follow them. But they brush and floss them just like their natural teeth, literally.
Do people name them?
Not yet.
Not yet. Not that you know.
That might be a fad in dentistry.
I'll tell you what. When my sister had dental implants, and she came here from Massachusetts. She didn't know anybody, and we went to a party somewhere. And I would walk, and I'd walk up to people, and I would say, "This is my sister Joanne. She's had implants," and I'd walk away.
Hey, eyes up here, buddy, right? That's what she'd say. Look into my eyes. Well, it's great meeting you, and I know that, as time goes by, I have a feeling that at some point, dental implants will probably surpass or at least equal the bridge work that's being done around the country.
I agree.
People still use dentures?
Yes, unfortunately. Yeah, they cause much more damage than they do good, and most patients just aren't educated about that when they get their dentures. And we do public seminars. We try to educate people on their options to make sure they can make a good choice for themselves.
All right.
Yeah.
Good meeting you, Dr. Gary Jones, who apparently works on everybody here at the Cumulus Broadcast Center except me.
Goldie, we'll see you in the office.
It's good meeting you. Thanks for coming in.
Too.
And great information on, new medical advances. They're happening every day, and it's just about getting the word out to folks that these things are available for them. It is 9:38 right now. We'll take a break, and then we are back with more Good Morning Fayetteville. Going to be a nice day, mostly sunny, upper 70s today, 63 right now in Fayetteville. Goldie and Jim on News Talk 640 WFNC.
Okay, forest animals.
You're awesome.
Great.
You're awesome. Thank you so much.
Great. Good.
Yeah.
Now, are you a friend with Michael Fleischman?
Oh, I know Michael well. Yes, very
Yeah.
well. I'm part of the community concert stuff. So
Good.
yeah.
Really excited about this year.
Yeah, it's a great year.
We just saw Hall & Oates. First time I'd ever seen them. They were in Raleigh. They were at Walnut Creek about
really?
a year and a half ago.
I'm going to be giving a lecture in Chicago when they're here.
Oh,
and
they
that
were
was
great.
the one I wanted to see.
They were great, but Jay Leno Leno will be
I
great
agree.
too, because I saw Jay Leno in D.C. when I was living there before the Tonight Show. He really toned it down for the Tonight Show because he had to play to Peoria,
Right.
but he is so much funnier in concert. So I'm looking forward to Jay Leno. I'm not a great Boys to Men fan, but Chicago and Pete Cetera.
Cetera,
Yeah,
I'm telling
so-
you, that was a good get.
I'm looking forward to that too. Good meeting you.
Good to meet you,
Anytime you need
Goldie.
anything, give me a call.
Appreciate it.
Thanks.
Thank you.
Bye.
See ya.
Take care.
Nice to see you.
Good seeing you.
See ya.
Did it cut off? I think it did when I shut it.
Yes.
Okay.
That's good.